Thank you.
This is for you. Do you need that? For the PowerPoint? No, I don't. Okay, good. Good morning. I'm very pleased to be here with you this morning. And I come to you, first want to tell you I'm a caregiver for my mother-in-law. Now, my mother-in-law is over 90 years old. She's deaf, and she's living independently. And I'm so proud to know her because she gave me my husband. I wouldn't have my husband without her. She's living independently, but it's been a struggle. She's healthy in that she has no chronic conditions, really. And she is living, enjoys doing word puzzles, those word finds. We play double solitaire together, and if I prompt her and get her going, and she can beat me, and we have a good time in doing that. But she's struggling with mild to moderate dementia. So there are a number of things that I do to help her at home, fixing meals, cleaning the apartment, washing clothes, getting her ready, doing a lot of things to try to keep her living independently, because if she wasn't and went into a nursing home, her life savings would be gone in a snap, and she'd lose a lot of her quality of life. So you can imagine, as a caregiver for her, that when the nurse called, now granted the nurse was doing her job, when the nurse called and said, you know, her cholesterol is too high at 91, and we want to increase her cholesterol medicine, I took a deep breath. I counted to 10 before I responded, because I said, for her well-being, for her health, we could care less about her cholesterol. We're struggling mightily to keep her living independently. How can you help me with that? I tell you this story about health, and that's the sign for health, the deaf sign for health. Health. I tell you that story because it illustrates for me the huge problem we have right now in America and probably many other countries, and particularly in the state of Minnesota, is that we're focusing more on health care than we are on health and well-being. I see this not only as a daughter-in-law who's working to keep her mother-in-law living independently and having a quality of life as long as possible, but I tell you that as a scientist, as a physician, as a policymaker, as the Commissioner of Health for the state of Minnesota, that we have a huge problem in that we're focusing so much on health care and not on health and what it takes for a population to have well-being that's physical, mental, social, spiritual well-being, not merely the absence of disease, as the World Health Organization would define health. So if you look at what we're doing in the United States, we're spending the most money of any country in the entire world on health care. And yet the Commonwealth just did a recent study looking at the seven developed countries, and the United States, for quality, we scored next to last. And for long, healthy, productive lives, we scored dead last. No pun intended there. So we've got a huge value problem here. The quality of what we're getting for all the dollars that we're spending. Quality over cost, value. We have a huge value problem here. Now, in the state of Minnesota, if you look, just bring it closer here, our state demographer projects that, yep, we're gonna get out of the recession eventually, and Minnesota is going to get back into a positive revenue at the state. Our annual revenues to the state are going to increase by 3.9%. Healthcare cost to the state for the people that we enroll in our programs in the state to cover are going to increase by 8.5%. So any additional revenue that the state of Minnesota gets is going to be gobbled up by rising healthcare costs. It's going to rob all the other things that contribute to health, as you just heard the other speaker talk about. The healthy behaviors, education, affordable housing, economic development, a healthy environment of safe water and air and so forth. That contributes 80% to what makes a population healthy. Health care and access to health care is only 20%. We are investing in that tremendously and going to neglect the other 80% that would actually make a population healthy. So you might say, as Commissioner of Health, are you pretty depressed? I mean, the numbers don't look good here for the trajectory in which we're going for a population health and how we're investing in the wrong places, and we're going to rob what would actually give us health. Well, actually, I see hopeful signs. I'll start with 2008 comprehensive legislation that we passed here in Minnesota. We passed it, and it starts with an investment in public health. It starts with tackling tobacco and obesity, the leading preventable causes of illness and death. It's in that category of healthy behaviors that'll make a population healthy. And we're not doing it by programs. We're doing it by investing in changing policy, systems, and environments. So we're going to make our college campuses smoke-free. That's the next new foray for the tobacco industry, is to go after our best and brightest. We're changing policies on secondary education campuses so people are not exposed to a norm of people smoking or to secondhand smoke. We're going to make our cities and counties and places more bikeable and walkable so people can be physically active because it's there and it's part of their everyday life. We're putting in community gardens and farm-to-school councils to get fresh fruits and vegetables into our schools, into our communities, to make, again, access to those things easier, and to make it so the healthy choice is the easy choice in how we change around us. So 2008, our legislature passed and our governor signed into law a statewide health improvement program that's about doing those things to change the policy systems and environments. We also are working on redesigning care and redesigning payment. You've just heard examples of how the care is not working for all to contribute to health. We're going to redesign care and payment. I think you've heard the Paul Batalden quote that says, every system is perfectly designed to get the results it gets. It's not that people are setting out not to give a good value. It's that we've got a system that's designed not to produce that. So we're working here in Minnesota, we call it not medical homes, we call them healthcare homes. I'd love it if we could have gotten to health homes, but we weren't quite there yet. But to think about how do we get a strong primary care base for people to get their health care, and then how do we think about linking that into some of those changes we're making in the environment and the policies in our communities so that people have health, not just more health care. So I see hopeful signs, and it brings me back to my story of my mother-in-law. We recently got a letter in the mail from one of our nonprofit health plans here in Minnesota. We're proud of that in Minnesota, that our HMOs are all nonprofit. A letter inviting her to join up, because they had partnered with a social services agency, to actually bring companions to people who are trying, like my mother-in-law, to live in her own place. And the companion's not a health care person. It's someone to come in, take you to the grocery store, maybe play double solitaire, do things with you, and to be a companion. Exactly what my mother-in-law needs in addition to all that we're trying to do. So I saw that as another hopeful sign, that people are beginning to see it's more than health care. It's more than calling and saying, your cholesterol medicine needs to be increased. It's about health. It's about well-being. And how can we bring and marshal all the forces in our communities to produce health? So I saw that as another hopeful sign. So it's about health. It's about well-being. And we've got to redesign our thinking, what we pay for, how our communities are engaged, how all of us are empowered to get our eyes on health and not just more health care. Health. Health for all. Do it with me. Health. Health. And you know what? I didn't even ask what the sign was for health care, because that's not what I want for my mother-in-law. That's not what I want for myself. It's not what I suspect you want. It's really more health and more well-being for all. Thank you.